Hi viewers, this is Dr. Muhammad Iftikhar Aslam from Pakistan. Today I'm going to present a lecture on exotic ticks such as Amblyomma variegatum, Rhiphicephalus microplus, Rhiphicephalus annulatus. In today's lecture, we will cover the information regarding the exotic ticks and the diseases they can transmit. We'll also talk about how to identify the exotic ticks, the impact these ticks have had in the past and could have in the future. Additionally, we'll talk about how exotic ticks are transmitted and species that affect. Finally, we will address the prevention and control measures as well as the actions to take if the exotic ticks are suspected. Exotic ticks are the ticks that are not found in the United States. These important ticks species and the diseases that they carry are the risk of introduction into the United States. These ticks include Amblyomma habrium, the bont tick, Amblyomma variegatum, the tropical bont tick, Ixodes riccinus, the castor bean tick. The next one is Rhiphicephalus, formerly known as Buphalus annulatus, which is the American cattle's tick. Rhiphicephalus, formerly known as Buphalus microplus, which is a southern cattle tick. And the last one is Rhiphicephalus appendiculatus, which is the brown ear tick. Tick bites can be irritating and painful. They also provide entry points for the secondary bacterial invaders or skewworms. Heavy infestations can damage the hides and may cause anemia, particularly when the animal is in poor condition. Rhiphicephalus appendiculatus, the brown ear tick, damages the ear of cattle and other livestock, and some species of ticks cause tick paralysis. However, the most important risk with the introduction of exotic ticks is that they may carry the agents of exotic diseases. The greatest danger is when the tick acts as a biological vector, but pathogens carried mechanically can be introduced if they survive long enough. Amblyomma variegatum and Amblyomma hybrium can transmit Ehrlichia ruminantium, formerly known as Cowdria ruminantium, the agent of heart-water disease. These ticks can also carry the Rickettsia africa, which causes African tick bite fever, and other disease agents such as Ixodes riccinus transmits a number of pathogens including Babesia divergens, which causes babesiosis, looping ill virus, and tick-borne encephalitis virus. Rhiphicephalus appendiculatus can carry the Theileria parva, the cause of East Coast fever, as well as Nairobi sheep disease virus and other disease agents. Rhiphicephalus microplus and Rhiphicephalus annulatus are particularly important in transmitting the babesiosis, which is caused by Babesia bigemina and Babesia bovis, and anaplasmosis caused by Anaplasma marginale. Babesiosis or cattle fever was eradicated from United States between 1906 and 1943 by eliminating these vectors. Rhiphicephalus annulatus and Rhiphicephalus microplus still exist in Mexico and further south, and a permanent quarantine zone is maintained along the US-Mexican border to prevent their reintroduction. The ticks pass through the four life cycle stages, although ticks have host preferences which may vary with the life stage. Most species will feed on a wide variety of wild and domesticated animals as well as humans. Amblyomma variegatum, Amblyomma hybrium, Ixodes riccinus, and the Rhiphicephalus appendiculatus are three-host ticks. Three-host ticks can be found on the host while they feed. Then they drop into the ground to develop into the next stage. Larvae, nymphs, and adults all require a blood meal. Once the adult female has had feed and mated, she deposits her eggs into the environment. The life cycle for Embryoma variegatum, Embryoma hybridum, Exodus ricinus usually takes more than a year and up to a few years to complete. Rhiphicephalus microplus, Rhiphicephalus annulatus are one-host ticks. All the stages are spent on a single animal. The eggs hatch in the environment and the larvae crawl up the plants to find a host. Newly attached larvae, seed ticks, are usually found on the underside of the animal, particularly on the softer skin inside the thigh, flanks, and forelegs. After feeding the larvae, they molt twice to become nymphs and then adults. Cattle are the preferred hosts for Rhiphicephalus annulatus. Measures used to exclude exotic ticks from a country include the pre-export inspection and certification that the animals are free of ectoparasites, quarantines upon the entry, the treatment with the acaricides. Three-horse ticks spend at least 90% of their life cycle in the environment rather than on the host animal and can be difficult to eradicate once they have become established. A single acaricide treatment can destroy all of the ticks on an animal but will not prevent reinfestation. There are two options for treating infested and exposed cattle. These animals may be dipped at regular intervals for 9 months. Alternatively, they may be treated until they are tick-free before two consecutive acaricide treatments, then removed from the infected pasture. The infested pasture must remain free of all the livestock for 6 to 9 months or longer to break the tick life cycle. If you suspect exotic ticks, state or federal authorities should be notified immediately. Animals suspected infested with exotic ticks should be isolated, and the farm should be quarantined until the definitive diagnosis is determined. Well, that's the end of our today's lecture. Thank you so much.